Just to kind of get started by way of kind of introduction, I'm Rachel Dowle. Yeah, we are absolutely here to talk about the work we're doing within the Scottish Government in the Office of the Chief Designer, specifically around building on that Scottish approach to service design, and really working across anyone who's involved in the design and delivery of public services, to really think about how you can involve people meaningfully in that work. We have been in the Scottish Government for a number of years now. We've very recently moved into health and social care, so I'm really glad to see that there's obviously so many people to connect with here as well. We're working on a number of kind of key areas. I'm sure we'll tap into a lot of the interest and why people are here today. My role specifically is to kind of help programme teams and organisations really plan at the earliest stage around how you are going to approach design. So really putting in some of those mechanisms to make sure that you create the right conditions and you set yourself up for success. I'm going to hand over to Anna. Hopefully she's here to just say hello and introduce herself as well.
Thanks, Rachel. Good morning, everyone. My name's Anna Henderson. I'm part of Rachel's team and I'm a service design lead. So really getting in and supporting teams to understand the Scottish approach to service design and thinking about how we can bring people with lived experience into the heart of what we do. So I'll pass back over to Rachel.
Thanks, Anna. Well, Anna hasn't said that she's a creative genius and she helps organisations get into the right mindset for design and has lots of different creative tools to help people do that. But we'll get into those details when we talk about some of the examples. We're really keen today to kind of draw on some of these threads, obviously, that we heard in that introduction around what does this mean in terms of human rights-based approach? How do these things connect? What are we meaning, in fact, by service design and co-design? And actually, what we're really keen to do is just give you some examples of the type of support we're putting in place and what we're trying to achieve. So we'll hopefully not spend any more time on this introduction and we'll get on with it. So, human rights and public services, thanks to a fantastic resource with the Scottish Human Rights Commission. Just thinking about human rights and public services, really just, again, connecting that piece around making sure that we're really actively thinking about how you can empower people to know and claim their rights, and really thinking about the accountability as well around institutions that are responsible for providing those services and fulfilling those rights. So it's really critical that this is thought about at the very earliest stage of any design project, particularly around public services as well. And the area that we're going to talk about, and the area that we really care about embedding within these projects, is really thinking about co-design, and it's that bit around shared decision making and power sharing. So really collaborating throughout that entire piece. So our definition of co-design, and as Lucy was saying, there's not one way to think about how you approach these things. There's lots of different methodologies and approaches, but for us around co-design, it's about establishing an equal and reciprocal partnership at all stages. Really importantly to think that through at the earliest stages as well, and put in the right mechanisms and create the right conditions for success. And that's across everything that goes into creating the service at the end of the day. So that's around the policies, the frameworks, and any interventions and any support around that. So when we talk about service design, there's service design the practice, but it's actually the design of services that we really care about. It's about really working with people to understand the current situation. Why are things happening? What do they feel like for people? But also working together to figure out what does that future state look like? And some of those service design tools that we're using as part of our support offer really help us kind of get people into a mindset to allow themselves to move into those spaces. But in the same respect around creating those conditions, we really have to work with people as well to say, how can we support you to take part? What will this look like? And how can we make this work for you? And how do we make sure that we're really clear around where those opportunities for co-design and shared decision making actually exist? There are occasions where you can't co-design everything. It's resource intensive, and you really need to be thoughtful and careful around prioritising what areas you start with. But really, in terms of kind of the methodologies, we're really talking about participation. We're talking about involving people in decision making. So critical to service design and co-design, it's about how you involve people. And that's one of those elements of the panel principles around participation. Everyone that has a right to participate in decisions which will affect them, and participation must be active, free, and meaningful and give attention to issues of accessibility, including access to information in a format and language that can be understood. It all feels very straightforward, and you kind of think, well, of course you would do these things, but actually putting these things in place does take time and planning and making sure that you actually do put in the effort to make this happen. I think too often we often see a kind of limited kind of resource put into making sure that these kind of elements are covered and that people do actually have those opportunities and understand where those opportunities are and are supported to be involved. So we really try to build that into our support model. It's really integral to everything we do in terms of that early planning phase right through to the delivery, and really demonstrating those good examples. A couple of slides just to kind of quickly talk through, just to make the point that actually this stuff is actually very hard to do and it won't happen overnight. What we talk about a lot is around the kind of early stage, like the readiness, the creating, the maturity. And what we have at the moment in terms of participation is almost kind of a line of, you know, we'll do a bit of engagement and we'll maybe engage across stakeholder organisations, and we'll maybe listen to people and hear about their experiences. And actually a lot of the control around that sits within an organisation that's commissioning that work. So really framing the work, thinking about how that engagement's going to happen, taking ownership over how we interpret evidence and data, and thinking about what that means, generating insights, and kind of thinking about what then do you take forward. And that often is what participation feels like currently. There are some pockets of fantastic examples where it feels much more collaborative, but really typically this is kind of what our environment is currently like for design. And we really want to work hard to kind of build maturity around the fact that we want to move to something much more collaborative. We want that kind of that piece where the decision making across all of those elements is shared. You know, you have collaboration with organisations who obviously have great insight and knowledge about experiences people have with services. Obviously, people with lived experience is absolutely critical, and all of the work should be framed around those people. And also just working together, getting together with government, with people who are delivering the work, and actually really collaborating. And that's what we'd really like to see, kind of an ecosystem, and build that maturity around design, a kind of a shared language, a shared understanding of how we do those things. So it's really about creating conditions for collaboration rather than framing the work and directing the work specifically. And I guess we always kind of want to talk about that, because what we do have is we've got very strong commitments around co-design in a lot of areas, commitment around working with, not for. It's really part of how we say we do our work. But actually, it takes time to get that right, and it takes time to build those conditions. So a lot of the kind of the support offer that we put in place is about equipping people with design skills, essentially. And in saying that, we do have some what we will call example principles. So Lucy had mentioned at the start around the Scottish approach to service design, which was a really, and we'll share the link to this in the chat as well if you haven't seen it, but really it was a way of describing how you could apply design to how we go about public service reform, and thinking about how you engage people in that. And that had a set of principles within it, which was how can we work towards these things? We can't put these things in place overnight. That will take time to build. But actually, how do we all go, actually, these are the things that are really important? Well, we've built on those, and this is just another example of that, specifically around health and social care. This is one of the early things that we had put in place when we moved into the Directorate General Health and Social Care, and working with organisations to say, actually, a set of principles that we want to agree on and talk about and communicate around how we kind of work with people, around how we frame our work around people, and how we drive that consistency across lots of different organisations who are essentially the part, you know, one of many parts of someone's experience or life event or moment that something happens to them. How do we make sure that we have an ability to work across those different silos to make sure that is coherent to people? Really importantly, that we're inclusive and accessible. So that piece around actually making sure participation can be meaningful. So how do we make sure that we have these design methods and that we're always building on that good practice so that people can participate meaningfully? and really making sure that people are part of that process. But it's something that you can build on, as well as kind of getting your high level commitment to, but it's something you revisit and you come back to, and you build and you bring in those case studies and good examples as we go through. And that's really what we're keen to do, and we're really keen to work with all of you and different organisations to be able to shine a light on those good examples, because people are always looking for that sort of inspiration if they don't know what good looks like. But I'm going to hand over now to Anna, who's going to actually give us, like, rather than the abstract, this is what all of these concepts mean. We're going to talk a little bit about actually some of the examples of where we've been doing that, and maybe some reflections on what that means for us in our work. So I'm going to just move on to the next slide, and Anna, I'll ask you to kind of talk us through those.
Thank you, Rachel. So we're going to talk about kind of two examples of the work in which we're doing what Rachel's just talked about. So the first is around the Promise Scotland. So we've been working with them since 2019, and we've been specifically helping them with kind of what we're calling the design school, but it's design training at its core. And it's all focused on helping deliver the promise. So ensuring that care experienced people in Scotland grow up loved, safe, and respected, and really putting kind of those people with lived experience at the heart of that work. So ensuring that we're creating the conditions so that people in the system and the people who kind of engage with the system, people with experience, are part of that work in delivering the promise. So kind of what that involved in a practical level was creating kind of their version of a design school. So we have done design training in government and to other kind of areas of the public sector. But it was really making sure we focused on their space, what they needed from that. And it was very much around empowering their own system to deliver those changes. So making sure that they understood what they were committing to by delivering the promise, as well as truly understanding how they could support the individuals with lived experience to be part of that process meaningfully. And kind of that work was really informative, and also what it led to, which was really exciting, was us being able to support a project around redesigning the children's hearing system, in which case it brought together people from CHS and SCRA and from individuals that supported the whole hearings process, so people with lived experience, advocates, police, and many more people. And what was really excited about that kind of truly collaborative and multi-organizational project was that we looked at the before, the during, and the after to really support those individuals work through the design process to create a report, which you can see on their website, around which was submitted to their working group around how the children's hearing system could be developed for people with lived experience. And I think what's really important about doing all this work practically that Rachel's talked about is co-design is a spectrum, and we really need to understand where people are on that spectrum before we come in and try and help them do what they're trying to do. Because you can't go from 0 to 100 straight away. It's a gentle journey. And I think what's really wonderful about being able to work with a promise is we've learned so much from it too. So we always have our core practices in place around ethics, data protection. And really what we're trying to do now is bring into that trauma-informed approach as well, thinking about how we can support people to be part of this fully. But it also means thinking about how we manage the spaces and the power in the room. So some really kind of practical examples of that was when we were working on this project with the Promise Scotland, we had the opportunity to work with Our Hearing's Our Voice, which are an amazing kind of organisation, and they really supported people with lived experience to be part of this process, and we were so grateful for working with us. And I think we very much learned that sometimes it's important to shut people with power out of the room to allow people with lived experience to have meaningful conversations and to own that space. And that was kind of a really powerful example of how we worked with people with lived experience. So we allowed them the time and space to come up with their ideas, to understand the context and to do the work themselves. And then they would share back to the people who were part of the working group or the project teams. So that's a kind of very practical example of how we did that. And equally, just to the minutiae of understanding how you create that safe space. So what kind of food you provide. So we had feedback for one of the events that we did that actually the food was too complicated and too fancy, and that put some of the people with lived experience off knowing what they could eat. So it's just worth bearing in mind that there's all these little layers that you can think about when you're creating those spaces for people with lived experience. Rachel, is there anything you want to add?
No, I'm not going to add anything, and I'm very aware of time, and I think Lucy will be angry on us if we go massively over. So we'll just quickly go over the next example, and then that's one final slide, and then we'll be done.
Thanks, Rachel. So what we then did was, from learning from the work that we did with the promise, we are now working with Get It Right for Everyone Pathfinders, so the GERFE Pathfinders. So we've got 10 cohorts across health and social care partnerships who are coming together to design this national toolkit. And what's really interesting about this work is we're doing arm's length collaboration and co-design. So this is very much around focus on creating that space, as Rachel had talked about, making sure that all the Pathfinders have a focus on their ethics, their data protection, and their trauma informed, so that they can go out and do this work with people with lived experience. So it's very much around pushing that opportunity for co-design and making sure that we're creating a safe space for the organisations to do it, but as well as those people with lived experience to be involved in that process. Over to you, Rachel.
Thanks so much, Anna. So just in summary, there's different models and there's been different projects that we work across around really trying to support organisations to think about how you work slightly differently and around how you kind of support people to take part. But there is kind of key element across all of those projects that we're really trying to embed into this model as we learn more and we keep working through, which is that the leadership and sponsorship are so critical around creating those conditions. Really, really important. This innovation can't survive or thrive without it. That we really need to be really proactive around creating opportunities for shared decision making. We need to plan that in from the start and make plenty of time for it. It's not always the case. The fact that we really need to work hard around establishing trust and relationships, and that's across organisations in the system as well as those taking part. People have maybe had poor experiences of services or have been part of consultations in the past that have felt hollow, and actually there's a lot of work there to do to help people trust the process, but also trust each other to be able to kind of come together and work together in that way. And that we really need to think about, and we're embedding this through our processes around those person-centred measures. Our system often makes us do things that we know aren't the right things, and it's really important that we take the time to co-design those measures throughout as well.